Cracking the code of stomach cancer. Discover causes, symptoms, and life-saving treatments. Brace yourself for a journey into the world of stomach cancer, an enigmatic disease that demands our attention. Get ready to equip yourself with vital information that could make all the difference. Hey there, welcome back to MindState. We're here to help you tap into your full potential and become the best version of yourself. In this video, we'll unlock the secrets behind this silent assassin, empowering you with knowledge that could save lives. But before we move forward, don't forget to like the video and subscribe to our channel and tap the notification bell so you won't miss any of our uploads. What is stomach cancer? Stomach cancer, also referred to as gastric cancer, is a serious illness that can develop in any part of the stomach. Understanding this disease is crucial, as early detection plays a vital role in increasing the chances of a successful cure. Stomach cancer is a type of cancer that originates in the cells of the stomach lining. The stomach, a crucial organ in the digestive system, plays a vital role in breaking down food and aiding in the digestion process. However, when the cells in the stomach undergo abnormal changes and multiply uncontrollably, they form a tumor, which can lead to the development of stomach cancer. It's important to note that there are various types of stomach cancer, each with its own characteristics and patterns of growth. The most common type is adenocarcinoma, which accounts for approximately 90 to 95% of all stomach cancer cases. Other less common types include lymphoma, gastrointestinal stromal tumors, GISTs, and carcinoid tumors. These different types of stomach cancer may require specific treatment approaches, highlighting the importance of accurate diagnosis. Who gets stomach cancer? Risk factors. Stomach cancer can affect people of all ages, but it is typically diagnosed around the age of 68. The disease develops slowly over time, and understanding the risk factors associated with it can help us prevent its occurrence. Smoking is a significant risk factor for stomach cancer. Not only does it harm the lungs, but it also increases the chances of developing this type of cancer. It is crucial, especially for young individuals, to avoid smoking and stay away from secondhand smoke to reduce the risk. Having a family history of stomach cancer also increases the likelihood of developing the disease. If close relatives like parents or siblings have had stomach cancer, it raises the risk. While we cannot change our family history, being aware of it can motivate us to be more cautious about our health and seek regular checkups. H. pylori infection, caused by a bacterium infecting the stomach lining, is associated with stomach cancer. Prolonged infection with H. pylori can lead to inflammation and ulcers, increasing the risk of developing stomach cancer. If diagnosed with H. pylori infection, seeking appropriate medical treatment is crucial to reduce the risk. Stomach inflammation, known as gastritis, is another risk factor. Chronic irritation resulting from inflamed stomach lining can contribute to the development of cancer over time. Managing conditions that cause chronic stomach inflammation, such as treating H. pylori infections or avoiding certain medications, can help reduce the risk. Gastroesophageal reflux disease, GERD, characterized by stomach acid flowing back into the esophagus, can cause discomfort and heartburn. Long-term GERD can damage the esophageal lining and increase the risk of stomach cancer. Individuals experiencing frequent heartburn or acid reflux should consult healthcare professionals for proper management. Dietary choices also play a role in stomach cancer risk. Consuming a diet high in salted, smoked, or pickled foods, while lacking sufficient fruits and vegetables, increases the likelihood of developing stomach cancer. To lower the risk, it is important to encourage a balanced diet that includes plenty of fruits, vegetables, and whole grains, while reducing the intake of processed and high-sodium foods. Symptoms of stomach cancer. One common symptom of stomach cancer is difficulty swallowing, also known as dysphagia. This can occur when the tumor obstructs the passage of food through the esophagus or into the stomach. If you find it challenging to swallow solid foods or even liquids, it is important to seek medical attention. Another symptom is bloating after eating. If you frequently experience a feeling of fullness or discomfort in the upper abdomen after meals, it could be a potential sign of stomach cancer. Pay attention to persistent bloating that doesn't improve with time or changes in your diet. Early satiety, which means feeling full quickly, even after consuming small amounts of food, is another symptom to be aware of. If you find yourself feeling satisfied with smaller portions than usual, or if your appetite decreases significantly, it could be an indication of stomach cancer. Heartburn and indigestion are symptoms that are commonly associated with various digestive conditions, including stomach cancer. Persistent or severe heartburn, especially if it is unresponsive to over-the-counter medications, should not be ignored. Nausea and vomiting can also be symptoms of stomach cancer, particularly if they are persistent and unrelated to any other obvious cause. If you experience frequent or unexplained episodes of nausea and vomiting, it is important to consult a healthcare professional. Stomach pain or discomfort is a symptom that can occur in stomach cancer, although it can also be caused by other conditions. If you have persistent abdominal pain, particularly in the upper abdomen, it is essential to have it evaluated by a medical professional. Unintended weight loss is a significant symptom to watch out for. If you are losing weight without intentionally trying, or without any changes in your diet or physical activity, it could be a red flag for stomach cancer or other underlying health issues. How is stomach cancer diagnosed? The primary diagnostic method is an upper endoscopy, which involves using a small camera to examine the lining of the stomach. During this procedure, if any abnormal areas are detected, a tissue sample, known as a biopsy, is taken for further analysis in a laboratory. In addition to an upper endoscopy, further imaging tests may be performed to determine the extent of the cancer. One common imaging test is a computed tomography, CT scan, which provides detailed cross-sectional images of the abdomen. This helps identify if the cancer has spread to nearby organs or lymph nodes. Another imaging technique that may be utilized is a barium swallow. In this procedure, a patient swallows a liquid containing barium, which coats the lining of the esophagus and stomach. X-ray images are then taken, allowing the healthcare provider to evaluate any abnormalities or blockages in the digestive system. By combining the information obtained from these diagnostic procedures, healthcare professionals can develop a comprehensive understanding of the condition, its location, and the extent of the cancer. This information is crucial in determining the most appropriate treatment plan for the individual. Treatment options for stomach cancer. The treatment of stomach cancer involves a multidisciplinary approach, where doctors from various specialties work together to develop an individualized treatment plan based on the patient's overall health and well-being. Understanding the available treatment options can empower individuals to make informed decisions about their care. Here are the 5 primary treatment options for stomach cancer. Surgery. Surgery is a common treatment for stomach cancer and involves removing part or all of the stomach, nearby lymph nodes, and sometimes other affected tissues or organs. The extent of surgery depends on the stage and location of the cancer. After surgery, additional treatments may be recommended to eliminate any remaining cancer cells. Chemotherapy. Chemotherapy involves the use of powerful drugs to kill cancer cells or stop their growth. It can be administered before surgery, neoadjuvant chemotherapy, to shrink tumors; after surgery, adjuvant chemotherapy, to destroy remaining cancer cells, or as the main treatment for advanced or metastatic stomach cancer. Chemotherapy may be given orally or intravenously. Radiation therapy. Radiation therapy uses high-energy X-rays or other forms of radiation to target and destroy cancer cells. It can be used before surgery to shrink tumors, after surgery to eliminate remaining cancer cells, or as a palliative treatment to relieve symptoms in advanced cases. External beam radiation and brachytherapy are 2 common types of radiation therapy for stomach cancer. Targeted drug therapy. Targeted drugs are designed to specifically target certain molecules or pathways involved in cancer growth and progression. For stomach cancer, targeted therapies may include medications that block the effects of specific proteins, such as human epidermal growth factor receptor 2, HER2 inhibitors. These drugs are typically used in combination with chemotherapy or as a standalone treatment for advanced cases. Immunotherapy. Immunotherapy works by enhancing the body's immune system to recognize and attack cancer cells. It can be used as a treatment option for some types of advanced or metastatic stomach cancers. Immune checkpoint inhibitors are a common type of immunotherapy used in the treatment of stomach cancer. The choice of treatment depends on various factors, such as the stage of the cancer, the patient's overall health, and individual preferences. Treatment plans are often tailored to each patient's specific needs, and combinations of different therapies may be recommended. Receiving a stomach cancer diagnosis can be overwhelming, but finding support from others who have experienced similar journeys can provide immense comfort. It's crucial to connect with cancer survivors online or in your community. Additionally, Educating yourself about your condition empowers you to make confident decisions about your care. Stay informed and optimistic as you navigate the path towards managing stomach cancer effectively. Thanks for watching, MindState fam. If you found this video helpful and enjoyed our content, please show us some love by hitting that like button and subscribing to our channel. We promise to keep bringing you insightful takes on anything and everything that matters. We appreciate your support and look forward to seeing you in the next video.